Today's guest is Renee Braun. She is a practice manager with Mercy Health, overseeing a family medical office and also an internal medicine office. My co-host today is Megan Byard-Carrabba. She is our college access specialist and also oversees the Promise in Muskegon County. So happy to have her. She's going to be monitoring the chat, making sure our videos and mics are off so we can listen to the conversation with Renee. Please use the chat feature to ask any questions. Type them in as soon as it pops into your head as you're hearing the conversation. We'll make sure to address those. And this session is going to be recorded. Therefore, if somebody couldn't make it today, they can always go back and check that. Before we get started with our conversation with Renee, I did want to share a video with everybody, just a short video from Mercy Health. So I'm just going to go ahead and play that.
Be positive.
Be a breath of fresh air.
Be a source of hope.
Be exact.
Be accessible.
Be an expert in your field.
Be compassionate.
Be a protector.
Be reassuring.
Be a healer.
Be accountable.
Be innovative.
Be a source of energy.
Be a life changer.
Be excellent.
Be 100% dependable.
Be mindful.
Be a hand to hold.
Be gentle.
Be a source of faith.
Be confident.
Be inspiring.
Be there at a moment's notice.
Be understanding.
Be reliable.
Be a great leader.
Be a hero.
Be present.
Sea excelente.
Be.
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 Remarkable.
Remarkable.
Be remarkable.
So I think I really like that video because it shows all the different careers, a variety of them within Mercy Health and how they all work together, especially during this time, how our healthcare heroes are really coming together for our community. So now we'll get started with our conversation with Renee. So Renee, again, thank you for being with us here today. So glad to meet you virtually in your setting. Can you kind of tell us a little bit about Mercy Health and your role within Mercy Health?
Sure. So Mercy Health is, of course, our local hospital system, but we are also part of a greater hospital system. We partner with, it was previously the St. Mary's Health System in Grand Rapids, and we are now considered All Mercy Health. And then we are part of even a larger health system with Trinity, and they are our governing body. They are located here in Michigan as well, but we have multiple hospital systems across the United States, and we have a lot of different specialties that we work with. And so here locally, Mercy Health is our hospital system here in Muskegon, but then we also have offices as north as Sable Point in Ludington. And then we also have some in the North Ottawa group. And we stretch as far as Grand Rapids, Rockford area. So we really try and make sure that we're a community-based hospital system.
Yeah, that's a lot of ground and regional is that. So tell us a little bit about your role within Mercy Health.
So I'm a practice manager. I work in the primary care, and primary care is considered something that is more of the ambulatory setting, and we are not working in the hospital per se, but we have ambulatory is family practice, internal medicine, but then we also have specialty like our GI group, our OB-GYN group, and cardiology. So me personally, I am the practice manager for a family medicine group and an internal medicine group. The nice thing is it's in the same building. So I just basically go upstairs and downstairs. And then our offices are able to, we have a wide range of staff that are in our office, but we also offer a lot of different services to our patients. We're really trying to keep our patients, first of all, well, but also so that they can come into our offices and get a lot of the services so that they don't have to go to the hospital. And we also want to keep them well so that they don't have to go and to be admitted to the hospital, or keep the readmission rate down. And that's something that's really important to us. So here in our family practice and internal medicine practice, we have both physicians, and we also have APPs, and they're our nurse practitioners and our physician assistants, and we have them both. And then we also have medical assistants in our offices. We have RN and LPN triage nurses. And we also have PharmDs, which are doctor of pharmacology, that come into our office, and they can work with our patients and spend a great deal of time with them, maybe talking about their diabetic medication, their insulin. We also have care managers who work with our patients who have been discharged from the hospital, making sure that they have everything when they got home. Sometimes patients are a little confused because their physician in the hospital will give them a certain med list, and they don't know if they should go back to the med list that their physician, their family physician. And so sometimes there's a little bit of confusion there, and they don't want to upset either one. And so our care managers work to make sure that they have a concise medication list. They also make sure that if they needed home therapy or any home services, that those are scheduled and done appropriately. We also have social workers in some of our offices. We don't currently in my office, but we do have them in other practices. And that way, when the patient comes in, they can have an all-encompassing visit so that they don't feel that they have to go to multiple different places, and they can get a very robust visit and feel like they left and had a lot of their questions answered. So with my role, I work with the physicians. We work on making sure that their quality measures are met, making sure with quality it's that they are getting their mammograms ordered, they're getting their blood work ordered, and that we're getting our well childs in. And then I work with them on financial issues. And then I work with the staff, with our medical assistants and our triage nurses, to make sure that they feel supported and that they have appropriate training. And then we also have, we call them BOCs, which are business office coordinators, and they could be doing anything from check-in to referrals to checking eligibility for insurance, and even some of our billing. And so they do that. And so my role is to make sure that first and foremost, everybody has all the tools they have or they need to do their job, and that we continue to do training and education. And then earlier this year, we took on a huge new computer project, and we took on a new EHR, electronic health record. And it was not only our primary care offices, which is what had happened in the past, but also the hospital system, which meant every laboratory, every visiting nurses department, everything was using this new hospital system. And we did this at the end of January, and about 3 weeks later, we had to start planning for COVID surge. So it was really interesting, but, oh, and my light shuts off if I don't move. And
no, that's a big undertaking when you had to take on Epic, the new medical records, and listening to your role as a practice manager, you have a hand in lots of different facets of that medical office and the different roles within that. So I'm glad that you expounded upon that. Did you ever think back to when you were in middle school and high school? Did you ever think that you would be a practice manager, and how did you get there?
I did not. Actually, I went to college to become a recreational therapist. which is a form of physical therapy that you work a lot of times with special needs children. And I was going to college, and I also needed to be employed. And I started working in a medical practice, and the practice manager at the time said, as long as you continue to go to school. And I continued to go to school, but I also found that I really, really loved the family medicine practice. And I also liked working with some of the quality improvement and also collaborating with the staff. And so my role kind of evolved in that. And then I have, just really love that. I've been a practice manager at a couple different practices, but they've all been through the Mercy Health system. And it's been really remarkable to be able to grow with the system and watch us and collaborate together. And even though I talk about, different things that I do during the daytime, our staff are phenomenal. I work with some amazing staff, and and it's basically just a partnership and making sure that everybody has what we all need. So we do a really nice job, and I'm really, really impressed with the staff. They have had a tough year, and they have done a remarkable job.
Yeah, it has been a tough year. I have 2 daughters in healthcare, so really can relate to some of the stories and some of the challenges that you guys have definitely experienced. So it sounds like, that experience of working in a office led you to being a practice manager. What kind of training, schooling, or college classes or degrees, credentialing are really important for your role?
For my role, first of all, it helped that I had the medical background, because quite often, even though I'm not a biller and I'm also not a coder, I quite often have to get into the chart and try and understand maybe why something didn't get billed appropriately, or maybe where a concern was. And so having a little bit of that medical background is really helpful. For my role as a practice manager, it's been really helpful to have my bachelor's in business administration, because I needed to be able to break down the financial pieces of it and some of our financial reports, being able to apply for different positions and things like that. And then I'm currently going back to school for my master's in health administration right now. So it's constant learning. It's a good thing, and I've been really happy. And what's nice working with Mercy is, first of all, they have been extremely supportive, but my director has also been the one who's been really kind of encouraging me to do this. And I find that to be really helpful. But I think with any role, having in any portion of or any role in our job is having a little bit of that medical background, so that you can kind of understand what different things are going on.
Yeah, I can see where that would be very important. I'd like to take a break here and see if we have any questions in our chat. Megan Byard-Krava, do you see anything in our chat? I know I have a couple of questions here that I saw came up.
Just one, and Renee actually kind of touched on it. It was about, do you think business classes are relevant to your position? And you did kind of touch on that a little bit. I don't know if you want to expound any more, but sometimes I think our students are all studying in the health field, right? I want to be a nurse. I want to be maybe a recreational therapist, right? But I think this question was more about maybe rounding out those degrees or credentials or experiences.
Sure. So business classes are very important. And also some of the things that our staff have found to be really important is understanding we have front-end staff, our BOCs at the front, who understand Excel really well. They get reports from our payers, and they have to dive into that. We also have people who work in our front end who actually have somewhat of a medical background. Maybe they have a medical assistant certificate, and they actually find that they prefer the front end work and the business end work instead. And we have people that are cross-trained to do both. And so there's a lot of things that having the medical background is really important, but then also understanding some of the business end of it and understanding that if you have kind of touched on all of that, you're very, very hireable, and you're also very, very cross-trainable. And sometimes in a smaller office, somebody might have to jump in. We found that quite a bit this year, is we were all doing different things, but we were all just kind of helping each other out. We were trying to do it while learning a new computer system, but it's really important. And one thing that I think that it's really important for some of our new students to understand is that medical assistants oftentimes can do all kinds of roles, even just in our family practice offices, but also they work in the hospital system. And when I've done this in the past, some of our students don't understand that there is a little bit of a difference between a medical student or medical assistant and an RN and an LPN. And I think sometimes when we go into an office, they just see all nurses as nurses, but medical assistants can be very specialized, trained to do different procedures, and so can RNs. And then also in our office, we have triage nurses that are RNs and LPNs, but they basically work with the patients and they do a lot of education. And so there's a lot of different things that you can do, but it's really important, the English background, the business background, Excel, and then also our medical background.
Renee, thank you for even sharing the differences between medical assisting and the levels of nursing, because I agree, when a lot of times in healthcare, students see doctor, nurse, and then not the nuances beyond there. And I know, like for medical assisting, for those of you students out there, that's usually 1.5 years to 2-year degree, and they have that available at MCC. My daughter is actually a medical assistant, and she actually has transferred that into working in a hospice environment. So it really can be a very versatile place. And then you can pivot from that to a nursing degree as well. We had another question come up in the chat. How many years does it take to be a practice manager?
Well, it kind of depends. Some people can come out of college with a healthcare degree, and then typically you grow into that role, and it'll take a few years because there's a lot of things that you need to learn and understand. And you also have a lot of mentorship with different people, my director and our different managers. And then it depends on where you want to go, because we also have, like you said, different levels of even medical practice managers. They could go into the director role, our vice president. And so sometimes it's kind of growing into a role. It's not something that you walk out of college typically walking right into, but it's something that you certainly can do with those degrees. And I think that that's where Mercy Health does a really nice job. And even our different systems that I've worked with, even locally, is making sure that you kind of grow into it and you're not thrown into it.
That is actually a good way to do that. Yes. So if we look at a day in the life of Renee Braun, how would that start? Like, when does your day start? What does a typical day look like? And how does your day end? And what time does it end? To give everybody kind of an idea of a day in the life of a practice manager.
Sure. So it's varied every day, but typically like this morning, we started at 7 a.m. and had a physician meeting with our physicians in our internal medicine practice, but typically between 7 and 7:30. And then something that has been really nice that we've implemented in the primary care is we huddle with our staff. And so at my Westview office, we huddle around 8 o'clock, and then adult med, we typically huddle around 8:15. And that is when we just do pick off the quick and easies. So-and-so called in today, so-and-so is going to cover, maybe letting somebody know that a physician is going to be gone next week because they've got a training scheduled. And we talk about those every day because it's not very effective if we wait and talk about those at a monthly staff meeting. You've collected a lot of information, and then the staff run a lot of those huddles too. And we also do a reflection and just kind of ground ourselves. Today we talked about the fact that this year has been very, very crazy busy, but we continue to laugh and we do a nice job. So that kind of grounds us in the morning. Now I also have a manager huddle, but it's a WebEx, much like we're doing right now. And that starts at 9 o'clock. And that's where we can talk about maybe one of the offices is short staff. I had to post that our freezer died the other day. And so today I'm going to be going to get a new vaccine freezer for our practice. And so then we're on the call with all of our Muskegon Grand Rapids managers, and somebody can just shout out and say, I've got an extra freezer, and it's solved, instead of having a stream of emails that go back and forth. And usually that's done by 9:30 in the morning. And then I will get into our schedules, make sure our schedules are appropriate, look to see if there's any concerns. Sometimes I will get complaints that will be sent to us. You know, I've called 3 times and I haven't gotten my prescription, and we dig into it and maybe find out maybe it got sent and it's a computer error, maybe it got missed, and dig into those and try and address those right away in the morning. I also will meet with staff throughout the day. Staff might send me a quick note and say, hey, do you have a minute to talk? And maybe they've got a concern, and it might be personal, and it might be something that they want to talk about, or they may have these great ideas that they're like, hey, if we do this, I think it'll work really well. And then usually I have to work on some financial things. I have reports that need to be turned in, and usually throughout the day we'll have different meetings, quality meetings and things. And my day typically ends about 5:30 every day. And just making sure, and throughout the day, I also round at both offices, and it basically is just walking past the staff and say, how's your day going? Do you need anything? And sometimes that's when they'll say, my phone isn't working. Well, let's get this fixed. And so it's rounding throughout the daytime. And sometimes people are having just a bad day and it has nothing to do with work. And you can tell them, you know, go ahead and step aside. And if you need to take a minute, or if they've got a question, we have a lot of staff that are actually going back to school. And so they'll have questions about tuition reimbursement and things. So throughout the daytime, a lot of it is just touching base with my directors and then our staff that we work with and providers.
Yeah, I hear a lot of your role, customer service, you know, even in your role to not only your staff, but probably the patients that you serve. Do you, as you look to hire people for your practices, what are some of the other skills that you look for in a MA or an RN or even a doctor for your practice, or somebody that would be like at the, you know, checking in those patients or looking over medical records? What kind of skills or are you looking for?
Sure. So we're always looking for somebody who can who has very good verbal skills and also can express themselves in a positive manner. We always talk during an interview and make sure that we know that there are tough situations that happen in the medical field, but how can you handle those? And make sure that they've got some good critical thinking skills. Most of the technical skills we can teach. It's the skills that you've gained with maturity and the ability to have a conversation with somebody, explain your point, and also make somebody feel supported. Those are some skills that we always want to look for in a new colleague. And sometimes people will be very honest with an interview and they'll say, I'm very quiet, and that's okay too. And sometimes it's just building up their confidence. And so that's something we do. We always touch base with our staff. Every year they have to fill out competencies. We make sure that people haven't swayed away from something, but making sure that they feel supported with that. And then we continue to meet with our staff to make sure that they feel like they're supported in their role and that they're engaged.
Awesome. I think I'm going to stop here again to take any questions that might be in the chat. Mrs. Byer-Kraba, do you have any that have come up?
I did. It's a great one. It's very thought provoking. So hopefully we can hear some great things from you. This question came from one of our participants, and she wants to know, what is your proudest accomplishment as a practice manager?
That is a great question. I think, there goes my light again. I don't know if I can necessarily tie it down to one, but we had one that I can come to mind recently is we had a patient who was really struggling, was really having a hard time being able to care for himself, was really having a hard time understanding the system. And sometimes medicine's hard to navigate. And I remind the staff all the time that we do this every day, but patients don't. So we need to take a step back. And we were able to get this patient a tremendous amount of care that he wasn't getting, and get him in a safe environment, get him medical needs that weren't being met. And I think that that's one of the greatest accomplishments. And that's just something that you can feel good leaving at the end of the day and know that that was a huge win for the group. And it wasn't just one person, and it wasn't just a physician. Actually, our medical assistants worked day in and day out to make sure that this patient was supported. And it was just a huge win. And you could see they were really proud of themselves. So
that's awesome. I do have a question that came up. What are some of the reasons for stopping at medical assisting? For example, stopping at occupational therapy assistant rather than becoming an actual occupational therapy or therapist?
Sure, and that's a good question too. We have medical assistants that feel very, very fulfilled in their job. And we remind them that there are jobs that they can do that they, that nobody else can do. And despite the fact that it does feel like a tiered approach, they're very important jobs. And sometimes it works better for somebody's family. Sometimes it's an educational concern. Sometimes people don't have the confidence to go back to school, and sometimes funding is a concern. But for some people, they feel really fulfilled in their job and they really like what they do. And so I don't think anybody should sell themselves short for maybe stopping at one level or another. It's just a really important job regardless of what you do.
Awesome. And I know somebody else is asking, what kind of college did you go to, and what degree? And I think you mentioned business administration was your background. How many years of schooling did you take in business administration? 2-year or 4-year or?
I have 4 years in business administration, and I'm hoping to be done in the next year with my master's. And I am going locally, actually here to Baker for my master's in health administration. They have a partnership with Mercy, and Mercy I know works with MCC as well. They also, Mercy does tuition reimbursement, and so they're constantly encouraging growth. So that's an opportunity too, where if somebody does want to look into growing into a different role, there are opportunities. So
yeah, I think, you know, it's really great when employers do have a tuition reimbursement program, because they are investing in you. They're willing to reimburse whatever cost that incurs up to a certain amount, and that helps you really pay for that schooling. So that is really a nice offer of Mercy Health. I have one more question here. How much does a practice manager make?
Well, it kind of depends. We have three, we have 3 tiers of practice managers here in Muskegon. It's decided on how many physicians that you oversee, or providers you oversee, and then also how many colleagues. And then also it may change in tier if it's a specialty practice. So we have a manager 1, 2, and 3. And sometimes our newer managers will start in maybe a smaller practice where they're overseeing 2 to 4 providers and 12 staff. And typically it's a family medicine practice. It's not necessarily specialty. And those are our tier 1s. And then we have tier 3, And that might be somebody who's managing like our cardiology group, and they have multiple locations, they have multiple specialty, and then they also have, not only do they see patients with exams, but then they also do testing there, and they have a testing center. So it's a very huge range. And I apologize, I'm probably not going to be able to give a really accurate answer, but that might be
That's
something.
Okay, even if it's just, you know,
it's a very large range, and there's a lot of things that will decide that. But it is also a very good career, and it is something that can help support a family, you know, well. So hopefully that answers,
Awesome.
Mary.
Yeah, I think that's helpful to know that there is a range and there's growth within that. If you start at that tier 1, you can work up to that tier 3, where there's, like you said, lots of different moving parts with that level. One last question I'd like to ask is, what advice would you, in our remaining time, and then we'll check to see if we have any last minute questions, what advice would you give students that are looking to go into healthcare and they're in high school or even in middle school right now? What would be some next steps that they can take, and what should they be doing after high school to prepare for those careers in healthcare?
Sure. First of all, I think it's really important to understand that healthcare is one of the largest growing opportunities for any student right now. There are opportunities both as a clinician, as a nurse, as a provider, a nurse practitioner, a physician, and there are also different roles in billing and coding. We have people working in biomedical engineering. We have people who are working as anesthesiologists. It's a very, very huge role. And so I think it's really important for people to understand exactly what they want to do, and also understand that their talent, what their talents are, and do your research on that, because when you are looking for something that you're going to grow into, and especially if you're going to spend any kind of time in college, you want to make sure that it's going to grow with you as well, and that those opportunities are going to be out there when you're done with college, or that you can grow into. And then the other thing I would really encourage anybody, and anytime that I've ever talked to students, is make sure that you love it, because you're going to be working a very long time, and you have to love your job regardless of what it is, and you have to be proud of what you do. And it doesn't necessarily have to be, you know, a very big title that you get, but you have to love what you do. And they're all very important jobs. And I think it's important for you to do the research, ask people if they've been in a role, and ask them what they like to do, and really understand that healthcare is something that really has something probably for anybody who has any kind of talent and any kind of skill set.
Yeah, it's very flexible and very versatile. The opportunities are just so wide and broad. Mrs. Beyerkrabbe, do we have any more questions from the chat before we wrap up today?
I am not seeing any more questions from our chat.
Good. I think that we've answered some of the ones that came through. Renee, we really just appreciate you taking the time today, sharing not only your path and some advice for our students, but some really great information for those looking to get into careers in healthcare. I just want to say, from my perspective, I thank you for your time, efforts, and all of your staff during this COVID time, that the sacrifices that have been made, and I really appreciate that, and appreciate, like I said, the moment that you have taken with us today in your busy schedule. So with that, I will be signing off, and thank you all for joining us, and have a great holiday, and see us again in the new year with our Future Focus series.
Yes, I wish everybody the best of luck. Thank you.